Hello and welcome to our webinar, Avoid Medicare Pitfalls, 37 health questions that block your path to supplemental plans. Hi, I'm Monet Swan, your host today, and we're going to dive into some critical information that will help you understand and make informed decisions in the world of Medicare Advantage plans and supplemental health questions. So I will share with you 37 key health questions you need to know and how answering them correctly can move you right out of your Medicare Advantage plan to a supplemental plan if you like. So let's start with a little bit about why people love and adore Advantage plans. First of all, they often come with zero premiums and various perks, which sound absolutely fantastic. However, they also have some significant drawbacks. First, these plans have provider networks, either HMOs or PPOs. And the HMOs require referrals to see specialists and limit your ability to go out of network except for emergencies. And PPOs are more flexible, but can be costly if you go out of network. These restrictions and the potential for whole hospital groups to completely leave the networks can be frustrating, especially as we age. Another major issue is pre-authorizations. Up to 72% of healthcare services require pre-authorizations, meaning that the insurance company has the final say on whether you get the care your doctor recommends. This process can cause delays or outright denials of necessary treatments. Lastly, Advantage plans operate on a pay-as-you-go system. While the premiums might be low, the out-of-pocket costs for hospital visits, specialist appointments, and surgeries can add up quickly. This often leads to higher overall expenses compared to traditional Medicare with a supplemental plan. So for this conversation, we are talking about when you can enroll or disenroll into a Medicare Advantage plan or supplemental plan. Now, there are 2 times during the year when you can switch your plans. During AEP, October 15th to December 7th. Now, if you switch plans during this period, the new plan takes effect on January 1st. And open enrollment period, which is OEP, is from January 1st to March 31st. And if you switch plans during this period, the new plan takes effect the month following your switch. So it's important to note that if you've been on a Medicare Advantage plan for a few years and want to switch back to a traditional Medicare with a supplemental plan, you must medically qualify to do so. So let's talk about why you are looking at this video. Well, the health questions, 37 in fact, that you will have to answer that gives you the key to unlock a new supplemental plan. If your medical or health condition says yes to any of these following questions, well, unfortunately, you might get denied. The purpose of the application is to give the company the ability to decide whether to approve or deny your coverage. So without further ado, let's get started. And if you'd like these questions, we can also email them to you as well. So now remember, answering any of these questions with a yes could be a no with respect to you changing your current coverage with a Medicare Advantage plan to a traditional Medicare with a supplemental plan. So listen carefully. Some of the questions ask for a specific time frame, and some will ask if you have ever experienced any of the following. For those of you who have had a life insurance policy, you'll be familiar with many of the questions. Now, on to the questions. Are you dependent on a wheelchair or any motorized mobility devices? Are you currently hospitalized, confined to a bed, in a nursing facility or assisted living facility, or receiving home health care or physical therapy? These are anytime questions, so if this has ever happened in your life, they want the answer. Have you been medically diagnosed with, treated for, or had surgery for congestive heart failure? Have you been medically diagnosed with, treated for, or had surgery for an unoperated aneurysm? Have you been medically diagnosed with, treated for, or had surgery for defibrillatory? Have you been medically diagnosed with, treated for, or had surgery for leukemia? Have you been medically diagnosed with, treated for, or had surgery for lymphoma? Have you been medically diagnosed with, treated for, or had surgery for multiple myeloma? Have you been medically diagnosed with, treated for, or had surgery for cirrhosis of the liver? Have you been medically diagnosed with, treated for, or had surgery for Parkinson's disease? Have you been medically diagnosed with, treated for, or had surgery for Lou Gehrig's disease, also known as ALS? Have you been medically diagnosed with, treated for, or had surgery for Alzheimer's disease or dementia? Have you been medically diagnosed with, treated for, or had surgery for multiple sclerosis? Have you been medically diagnosed with, treated for, or had surgery for muscular dystrophy? Have you been medically diagnosed with, treated for, or had surgery for cerebral palsy? Have you been medically diagnosed with, treated for, or had surgery for chronic kidney disease, kidney failure, or renal insufficiency? Have you been medically diagnosed with, treated for, or had surgery for Addison's disease? Have you been medically diagnosed with, treated for, or had surgery for a condition requiring a bone marrow transplant or stem cell transplant? Have you been medically diagnosed with, treated for, or had surgery for a condition requiring an organ transplant? Have you been medically diagnosed with, treated for, or had surgery for AIDS, AIDS-related complex, or HIV? Now the next questions are regarding diabetes. Have you been medically diagnosed with, treated for, or had surgery for diabetes that requires the use of insulin? Have you been medically diagnosed with, treated for, or had surgery for any complications with your diabetes, including retinopathy, neuropathy, peripheral vascular or arterial disease, or heart artery blockage? Have you ever been treated for or diagnosed with diabetes along with a history of heart attack or stroke? Have you been treated with medication that has been changed or adjusted in the past 12 months because of uncontrolled blood sugar? Now these next questions are a 36-month or 3-year look back. In the last 36 months, have you been medically diagnosed with, treated for, or had surgery for alcoholism or drug abuse? In the last 36 months, have you been medically diagnosed with, treated for, or had surgery for cardiomyopathy or atrial fibrillation? In the last 36 months, have you been medically diagnosed with, treated for, or had surgery for anemia requiring repeated blood transfusions or any blood cancer or blood disorder? In the last 36 months, have you been medically diagnosed with, treated for, or had surgery for internal cancer, melanoma, or Hodgkin's disease? In the last 36 months, have you been medically diagnosed with, treated for, or had surgery for hepatitis or any disorder of the pancreas? Now, this next set of questions has a 24-month look back, also known as a 2-year look back. In the last 24 months, have you been medically diagnosed with, treated for, or had surgery for an enlarged heart, mini stroke, regular stroke, or peripheral vascular disease, arterial disease, or neuropathy, amputation caused by a disease, myasthenia gravis, systemic lupus, or any connective tissue disorder, osteoporosis with fracture or arthritis that restricts mobility or activities of daily living. The next are the last 24 months. Have you medically been diagnosed with, treated for, or had surgery for any lung or respiratory disorder that requires the use of a nebulizer or oxygen or 3 or more medications for lung or respiratory disorders? In the last 24 months, have you been medically diagnosed with, treated for, or had surgery for any lung or respiratory disorder, and currently using tobacco products? Now this is a 12-month or 1-year look back. In the last 12 months, have you been advised by a medical professional to have treatment, further evaluation, diagnostic testing, or surgery that has not been performed, or have any pending test results that have not been seen? In the last 12 months, have you been medically diagnosed with, treated for, or had surgery for a heart attack, artery blockage, or heart valve disorder? In the last 12 months, have you been medically diagnosed with, treated for, or had surgery for wet macular degeneration and have taken or are currently receiving injections? In the last 12 months, have you had a pacemaker implanted, or for a man, had a PSA blood test greater than 40.5 if under 60, or greater than 6.5 if over the age of 60, or ever had a seizure? Was your last blood pressure reading higher than 175 over 100? These are the crucial health questions that determine your eligibility to switch from a Medicare Advantage plan to a supplemental plan. So it's important to be aware of these criteria to avoid staying trapped in a plan that might not be the best fit for all of your healthcare needs. Medicare can be confusing, and it's easy to make mistakes. That's why we've created this webinar and other resources to help you make informed decisions. If you found this information helpful, please subscribe to our channel, give us a like, and share our channel with your friends. We post new videos 4 times a week and do a weekly webinar every Thursday at 11 o'clock a.m. Pacific Standard, 2 o'clock Eastern Time. So you'll always have access to the latest Medicare information. So question, would you like for us to come speak to your community or organization, or have a one-on-one with us on Zoom? Give us a call at 833-300-4968 or email us at info@Secure65healthplans.com. Our Love and Trust Tour is moving around in all of the cities across the country, so give us a call if you'd like to do a meet and greet and interview us. We want you to be happy and informed with the decisions you make. Most of all, we don't want you enrolling with a stranger. Our goal is to do business differently for seniors. And remember, we are not putting down the Medicare Advantage plans. We just want you to make sure that you are choosing the right plan for you. So thank you for joining us today. Stay happy, stay safe, stay informed, and stay golden. I'm Monet Swan. See you, same senior channel, same senior time next week. Bye for now. Come be a part of our community, Secure 65 Health Plans. Join us October 15th through December 7th, Medicare Open Enrollment. ANOC, drop it off. We'll start looking at it right now. We are the vision, and we are disruptors. We are changing the way seniors do business. Become one of us. We are your community. We are here for you. No senior should ever enroll in Medicare with a stranger. Call us at 213-394-8885 or 833-300-4968 or email us at info@mybivx.com. Secure 65 Health Plans, where seniors thrive.